the agenda? Okay. Any public comment? You? The only thing I can think of to say for the chair's report is that a reminder that next month, the Health and Human Services Committee regular scheduled meeting would have fallen on MLK Day. So we're instead going to have the meeting on Wednesday, January 17th at 2 o'clock. And at that meeting, we will have Dr. Klepak, who is our county, do you know his title?
Medical Director.
Medical Director. Thank you. And he will be doing a presentation about supervised injection facilities. Should be an interesting topic. I've seen his presentation before, and he does a great job. County Administrator's Report, Lisa Holmes.
Thank you, Dan. The only update I can think of that would be of interest to this group at this moment is this month, the state of New York is contracted with a group that are doing surveys to conduct after-action reports from counties related to COVID and the response on the local level. So there are a number of county departments, including administration and the health department and others that were involved in the EOC to give feedback and after action to help with the state's overall emergency preparedness. So that's happening, and we're doing a lot around closing up the year.
Thank you. Any questions or comments for Lisa? All right. Then we are moving on to the Department of Whole Health. We have a number of items, and we're going to start with a presentation about the Community Health Workers Program. I think Samantha Hilson is leading this. Is that right? Or Frank? Hi, Frank.
Hi, everyone. Yeah, I'll just do a quick introduction. Samantha Hilson is our Director of Health Promotion, and she's joined by Emma Abbey, who is our Senior Community Health Worker. So they're going to talk to you about where we are so far, and I think where we're hoping we'll grow to. So I'll turn it over to Sam and Emma.
All right, thanks so much for having us, Dan and others at the meeting. I'll share my screen and we will get started. All right, can you see my shared screen?
Yes.
Yeah. Okay. All right, so again, I'm joined today by Emma Abbey, our community health worker supervisor. Let me close my Teams. And also Mara Schwartz, one of our community health workers. So we are going to give an overview of our community health worker program. So we've provided a timeline. A lot has happened over the past 2 years. If you can remember, during the pandemic, we ran a pilot with public health ambassadors, and we hired 4 individuals who really promoted the vaccination and did a lot of work around our pop-up clinics that we were doing throughout the county. And from that pilot, we made a proposal to the legislature to fund 2 community health worker positions, and that was approved for calendar year of 2022. And then we used that county support to leverage applying for a New York State grant, which is called the Perinatal and Infant Community Health Collaborative. PITCH is the acronym. And with that, we were able to hire 2 more community health workers, because that program, the main intervention is using community health workers to support folks in the community, specifically who are pregnant or have young children. And so now, fast forward, we have 4 community health worker positions. They all support this new PITCH grant, the New York State grant, but the 2 county-funded positions are funded by the county and some of our COVID funding, and they split their work between our pitch clients and more general community members, and also doing community outreach and partnership building for the department. And then we have 2 fully funded, grant-funded community health workers. And then recently we rebranded the pitch program, which is a bit of a mouthful you just heard. And you can see here in the lower corner, we have a new logo and name for this aspect of our program, which is called Healthy Infants Partnership. And we wanted to include a little bit of data, state data that just highlights some of the disparity that we see in our community by race around prenatal and birth outcomes. So this was specifically used to and was included in our application to the state for the pitch grant that we received, because a foundational priority for that program is reducing racial, economic, and geographic disparities. So I'll turn it over to Emma and Mara to talk a little bit more about the community health workers.
Yeah, so a little bit about our team. First, we're really fortunate to be comprised of a group of people who have a really rich and varied background. Our team's life experience is really diverse, and that has created an opportunity to have all of the things that you see on the screen. And we're able to learn from one another. So it's been a really great process. Our team has been able to put our minds together and really problem solve and meet clients where they are on their health journey, which has helped us meet goals and the health outcomes and improve health outcomes that we've set out. I'll turn it over to Mara to kind of talk about what we do.
Hi all, thanks for having us. I hope you can hear me. I think I'm unmuted now. So our program is absolutely wonderful. We act as liaisons between community partners and community members. We fill gaps where they exist. So we help them to navigate resources. We do warm handoffs. But we don't just hand out a phone number, right, and say, here, make this call. We follow up and we follow through, which I think separates us from a lot of the programs that exist. As diverse as they are in Tompkins County, we set up action plans and goals with our clients, and then we make sure that services are followed through with, and with the end result really being that the client feels empowered to then either not need services anymore because there are services anymore because they've come to a stable place in their lives, or they feel confident and empowered enough to be able to do this on their own. We do use trauma-informed practice with everything that we do. Many of our clients have experienced significant trauma, so that is a big part of the language that we use with them. So, as I said, we work very, very closely with our community partners. These are some of them that we work with regularly that are instrumental in helping our clients succeed. It takes a village, and we do work very closely with them to make sure that everybody is receiving what they need.
Just a quick snapshot of who we're currently serving between both sides of the program. We have 40 clients enrolled. We started seeing our very first clients in July of 2022, but really didn't start ramping up and receiving referrals until December of last year. So it's been a whole year now. And in that time, we've had 115 clients who we've had touch points with, either kind of like a one-off situation where a referral was made and we were able to assist, or they've continued to receive our services and have enrolled in the program. And then from some of those, some clients have also been discharged from services as well. And then a quick note, we also have 12 clients who are in the process of becoming enrolled right now, which would bring our total to 52 clients who are like continually receiving services. And then currently eligibility to enroll in our program is pretty low threshold. The biggest thing is that the client, has to be living in Tompkins County. And then for HIP Tompkins, per the grant, they need to be of reproductive age or caring for a child under 24 months. Services are free of cost and there's no insurance requirement to receive services, which has been a big barrier for some of our clients for other programs. And then we wanted to just highlight some demographic information. So you can see on the right side, the bottom right side of the slide, that most of the population that we're working with on the general side of our program, they're a little bit older. I think most people are 45 or older. And then on the next slide, you can see that it's a little more varied and really shows kind of similar to the birth age of the parent at time of birth of their infant in our county. One thing that we do want to focus on in 2024 is just improving the demographics that we ask individuals so we can paint a better picture of who we're serving in the future.
So when I was asked to provide a client story to sort of humanize everything that we deal with every day, it was really difficult for me to pick a particular client because we've had such great successes that I absolutely love to share about. It brings me such joy. But the client I'm going to speak about today, she was referred in August of 2023 due to an open CPS case that had been made because of drug and substance abuse. There was also domestic violence occurring in the home where she had where she has a 3-year-old child living with her. Once I built up rapport, she did explain that the drug use was due to unresolved and untreated mental health issues. And she was hesitant to receive mental health treatment because of past negative experiences. Upon really building up that rapport with her, she gradually became more receptive to it and she eventually enrolled. I had kept in really close contact with her CPS worker and we were really impressed by the progress that she had been making. We contacted Law New York to deal with the legal issues regarding the domestic violence situation. I spoke with Section 8 to get her moved into a more safe environment. And these are things she never would have considered before. She was always very hesitant to get in a car with anybody that wasn't her mother or her sister. Now she will let me drive her. She will take the bus. She will do so much on her own. And it is absolutely remarkable to see. Her child is she's also unfortunately experienced trauma and she was hesitant to enroll her child in mental health services. But again, upon reflection and a lot of discussion, she enrolled her child in mental health services. So we're getting ahead of it at a very early age. And she's very proud of herself. Her drug tests are voluntary. They come up clean every single time. And due to that, we were able to discuss with her CPS worker that the case should be closed. We mutually agreed that she is progressing very positively, much more quickly than we would have anticipated. And so some services are no longer needed and CPS case is closed. So this is one client that I am very, very, very proud of and very proud to speak about. And there are a million others, but I just wanted to share this one with you.
Thanks, Mara. The last thing that we wanted to mention today were some key steps for growth, specifically in the first half of 2024. As Sam mentioned, we launched our new name and logo for Hip Tompkins just a little bit ago, and we created a brochure that you see on the screen that's been distributed throughout the county. We also plan to share out our program in local media and finalize the website that we've been working on. We also want to share and strengthen our relationships with community partners, connect with the community, specifically engaging in outreach events, and continue to develop and grow our community action board as we continue to gain new clients.
Well, all right, if there are any questions, that's our presentation. Thank you.
Thank you. Questions or comments? I'd be interested in trying to understand a little more. First of all, is everyone in the program, every client pregnant? Is that accurate?
You did catch that, but not every client is pregnant. No, that the pitch program is specifically targeted at working with individuals during reproductive age is a main criteria. So that can include someone who is pregnant. It can include someone who has an infant or a young child under 2. It can also include people who are in between having children, or it can include those who are caring and have children through, that they are in their custody through various routes. So that could include adoption or foster children. So runs the gamut.
I see.
Yeah, and that's for the pitch program, and then we're still working to have clients who are outside of that those requirements.
Thank you. And another question, I guess I'm just trying to understand what maybe an average day looks like in this program. I see the list of things that you gave in your example of a success story: legal assistance, food insecurity, mental health support, child protective services. But those aren't services that you provide, right? I'm just trying to get a sense of what happened. Someone's enrolled in your program. What does contact with them and between the two of you look like? What do you spend your time doing with them?
I can speak to that if Sam and I are okay with that. Our days are very varied, and I understand exactly what you're saying. These services are provided, but not by us. What do we do? So initially, we do sort of an intake, right, where we discuss with the client what they're experiencing, and we decide what the most urgent needs are. And then from there, we make contact with community partners. A lot of the work that we do when a person is going through significant trauma, whether it be they're experiencing homelessness, food insecurity, mental health issues, domestic violence, etc., they're really not able to take on maybe calling everybody themselves, right? They want us to make those connections. They need us to make those connections for them. So we help to establish those connections, and then we work we do work as a team, not sort of, we work as a team. And we collaborate and communicate with not only the client, but the workers themselves in each different community partnership. I can give you a for instance. A for instance would be, I have a client in the general community health program who has a lot of difficulty keeping up with his appointments because of his mental health issues. He is currently unhoused. He and myself and his worker at St. John's are in very close contact every day, trying to figure out the best route to help him. they make calls, I make calls, and then we come back to the client and discuss anything else that they need. Again, the initial goal is really to help them navigate the system that is, we know, very difficult to navigate, but the end result is to get them to be able to do these things on their own. But we're essentially providing case management, emotional support, and anything that they really need. So our days are really spent sort of making calls, having conversations, navigating housing, going to food pantries, you name it, we do it.
Thank you. Amanda.
Great, thanks for the presentation and all this information. I think I'm also trying to understand, so you have a couple of different charts. The first one, the data charts, they show that a large, well, I guess I'm not exactly sure what the first one is, but I feel like you said your goal is to help, minority folks, people who historically don't get the care that they need. But then one of the charts shows that it's largely white folks that you're helping. So how are you hoping to reach more people of diverse backgrounds?
Good question. So we showed some different demographic data. The data related to the prenatal and birth outcomes connects more closely with our HIP Tompkins or pitch clients. And so that demographic data shows that there is a wider range of different backgrounds of folks who are being served by that program, and that the general CHW population is a higher white percentage at this time, but that the HIP Tompkins clients, there's about 12% Black and African American noted in this graph, and then we have a higher than we would like percentage of unknown for the race category. And so that's certainly something that we're looking to improve both in our program and across the department.
Okay, thanks.
Randy.
Yes, thank you. Good information, and looks like a very good proactive program. What is, building on Amanda's question, what is outreach, and how do people, what's the best way for people to connect with you? Is it by phone or through events?
Emma, would you like to take that?
Sure. So really, we see a lot of outreach events happen during the summer. That's really when we're kind of out and about in the public. Things like Ithaca Festival, we table at like the libraries throughout the year. Activities like that where people may be out in larger groups, so we have a larger chance of meeting people. And then I'm sorry, I forgot the second part of
Just curious, primarily, is it through a phone call to Whole Health, or what's the...
Yep, so you could call the main line, and then also we have an email we could pass out as well. It's just chw@tompkins-co.org. Those would be the best two ways to contact, and then also if we're out in the public, we can meet with people and gain clients that way as well.
And then again, we've been working, very closely with different community partners, especially for the pitch grant, other community organizations and agencies that work closely with populations that are pregnant or have young children. And so we've been getting direct referrals as well, and our different programs within Whole Health, we've been seeing an increase of internal referrals as well.
Thank you.
I just wanted to quickly comment, sorry, didn't mean to interrupt you. I just wanted to quickly comment that in addition to what Sam said, that we do get direct referrals from community partners, we also get client referrals. So a client will be enjoying our program or have had success with our program and then refer a family member or a friend to us. So we can end up having various clients from the same circle that way. So it's a really interesting referral process because it comes from so many different places.
Thank you. And my second question is, part of this, of the people you're employing are funded through a grant. Is that grant for another year, 2 years, or what's the status on that?
Yeah, good question. The New York State grant is a 5-year grant cycle. So we are in year 2.
Thank you.
Any other questions or comments? Well, great. Thank you very much. Much appreciated.
Thank you.
Hey, we still have whole health. We have a whole list of things. Next up is resolution authorization for Tompkins County to enter into a memorandum of understanding with the City of Ithaca for opioid settlement funds, whole health department, and City of Ithaca. Is there anybody that would like to move that? Susan moves, Travis seconds. Frank, you want us to talk? Want us to talk about it?
Sure. So in an effort to make this super and easy and efficient for counties, the opioid settlement funds have been broken up into like a dozen different pots. And it's really just created some complications that we're trying to smooth out locally. You know that there were funds that the county received that the opioid task force deliberated around and administered out to community partners. There was also a pot of money that came to the local government unit, which is the mental health department. And the City of Ithaca also got a small pot of money for opioid settlement funds. So Ithaca, City of Ithaca took some time and looked at if there was a way that they thought that they could use those funds effectively to meet the needs of the community in compliance with the opioid settlement fund requirements, and really came to the conclusion that it would be most beneficial if they partnered with us. And so what they're proposing to do is combine their pot of money that they received and will be receiving each year with the pot of money that the local government unit received as well. So essentially what'll happen is that the project that we've been working on for the opioid settlement monies for the LGU, those monies from the city will be combined with that. Which will allow us to serve a few more people in that program. And what we're doing is committing to that equal portion of funding, supporting that equal portion of participants in the program. We had already expected there was going to be probably a majority of participants from the City of Ithaca anyway, so it won't be difficult for us to kind of navigate that part of it. But it really is a bringing together of resources to try to maximize their impact in our community. And so what you have in front of you is an MOU, a resolution to authorize Lisa, county administrator, to sign an MOU with the city for the combination of those dollars. What's in your packet is what went through Common Council. It is not expected that it's the final language. It really was subject for you all to kind of see what we're proposing and what it might look like, expecting that when it comes time to actually sign, there'll be a bit of refinement that has to happen by the city and the county to complete that. But generally speaking, it's an MOU to agree to use the city monies in collaboration with our local government unit opioid settlement fund.
Thank you. So just to clarify, we have on packet page 9, we have our resolution, and then packet page 10 and 11, though that's the city resolution?
Correct,
okay.
Including the language that will populate the MOU.
Questions or comments for Frank? And then Frank, before we vote, do you want to say a little more about the part that's left unresolved, the list of positions, titles included in the oversight committee.
Yeah, so as it was going, we were trying to move these quickly through, and we didn't get to finalize that conversation with the city. But we're going to recommend that group be the Community Services Board, because they're already the advisory and oversight for the LGU funds anyway. So they will be reviewing and serving as the oversight review for the LGU components of those funds. We just haven't been able to finalize that with the city yet. But I don't imagine there's going to be much difficulty with that.
So we're going to ask them to let our existing infrastructure administer this with the understanding that we will report to them regularly. Is that pretty accurate?
Correct.
Thank you. Any other questions or comments? Ready to vote then? We're all here, so all in favor? That is unanimous. Thank you, everybody. Thank you, Frank. Next up is appropriation from contingent fund, Mental Health Association, Whole Health Department. Does somebody want to move that? Amanda moves. Travis seconds. Frank?
Yes, thank you. So this is an unfortunate error that we're trying to correct. Back in 2022, the legislature authorized one-time funding over 2 years for the Mental Health Association, which would be calendar year 2023 and calendar year 2024. We had an oversight, unfortunately, and during your budget process that you just completed, we did not include the second year OTR to the Mental Health Association. So it did not go through the normal budget process. So we're bringing it forward now for your consideration to fund that for 2024.
Questions or comments? Randy?
Yes, I'm trying to think. I remember this program we were talking about. It's an actual location on the Commons.
Yes.
Okay. Any thoughts on how that's going and how it's operating or like that?
Yeah, the reports that we've received have been good. They're serving folks. It's obviously a centralized location. They've been offering trainings in the space as well. So it definitely has served our community. I think what we'll be looking to do in this year is trying to find a sustainability plan to work with the Mental Health Association on that. Because I don't think it was anyone's intention that this be long-term county funding.
Thanks, and I just want to say that this resolution reminded me about this program, and I had intended to ask them for an update to this committee at some point. And I will follow up with that.
It's a good way to fund things without affecting the levy. That was Joe.
Okay. Any other questions or comments before we vote? All right, all in favor? That is unanimous. Thank you, everybody. Next up, authorization for Tompkins County to enter into a memorandum of understanding to provide co-response services, Whole Health Department and City of Ithaca. Somebody want to move that? Travis is moving. Susan's seconding. Frank?
Yes. So this is some really good news as well. We were able to identify a licensed clinical therapist to serve the city. As you remember, the legislature funded 2 licensed clinical therapists as part of this pilot project. One has been working with the sheriff, and the other was for the city of Ithaca. So this MOU is really creating the relationship so that we can stand up that second care team. I will tell you it's likely going to be a little bit different in the city because they don't have a single officer to assign. So we're working with them on a process that would make sure that our therapist is partnered up with a officer on every shift and be available for the different types of calls. So this is really us just launching with the city the second care team and authorizing the county administrator to sign an MOU so that we can do that.
Thank you. I was just informed I did this out of order, so thanks everyone for riding right into that. Questions or comments about this resolution? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody. Before we go on to the next one, I realized I had a question about a previous one, so I know we already voted, no problem. It's just a clarification question. This is back to the one about the Mental Health Association. And it says that the money's coming from the contingent fund. And so I just wanted to be clear, is that the 2023 contingent fund or the 2024 contingent fund? Not sure.
It would be for 2024 funding, so I believe it would need to come from the 2024 contingent fund.
Okay, should we insert that into the resolution tomorrow? Is it worthwhile?
Or
Yeah.
I'll confirm that in the meantime.
Thank you. Okay. Right, so now we're going back one step. We're on the resolution, authorization to accept funds, New York State Public Health Infrastructure Grant, Whole Health Department. Somebody like to move that? Randy moves, Travis seconds. Thank you. Frank?
Yes, so this is federal funding that's coming through the state of New York that was designed to fortify the public health infrastructure post-pandemic. And it's 5 years worth of funding. Unfortunately, it took the state a year to review and approve our contract. So we're just now able to bring forward the request to accept the funds. Our plan to use them is to create a position that will serve as an HR liaison / staff development position, which we're hoping will help improve our hiring, recruitment, and onboarding to find a more diversified workforce, give them a more positive interaction in their early days, months, and weeks, and months with the department, and then also help us build our training plan for the entire department in order to help staff both with professional development as well as organizational needs around training and staff development. So this is a position we've wanted for quite some time, and we're thankful that this funding will allow us the opportunity to create it.
Thank you. Questions or comments? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody. And then the last item on our list for this department is opioid task force update. It's on packet page 22. Randy had asked if we could get an update on where we're at with these. I guess the answer is that we're pretty early in the rollout of these contracts and programs, so we haven't gotten very far yet, but on packet page 22 is the list of where we're at, the dollar amount, the number of contracts, and who they've gone to. So does anybody have anything they want to say about this or ask about this? Randy.
Yeah, thanks for the update. It looks like things are moving along well, and my question is it the whole health department that is actually have to document that they're fulfilling these requirements before you, are we managing the money and documentation and all that stuff? How does that work?
So these particular grants, the contracts are being managed through county administration. So they've been working to put together the deliverables and contracts with each of the entities. We have been supporting that effort when they've had questions about the intent of the task force or if something makes sense within what's being proposed in the contract. So in this instance, we're kind of serving as subject matter experts to county administration who's handling those contracts.
Else? Frank, do you have anything else from Whole Health that you would like to tell us about?
Yeah, just one thing, going back to the very first resolution about the opioid settlement funds, we have been using one of our public health fellows, Ross Milne, to build that RFP for that project for the total LGU and city funding now. And so that RFP is going to be going out in January. And my understanding is for that process, I have to notify the committee that that's occurring. So I wanted to let you know that that's happening. You all will have a chance to review and approve the selected vendor of that RFP once we go through the review process and make a selection. So it'll likely be coming back hopefully in the first quarter of next year for review and approval of the selected vendor. So just wanted to give you that notification.
Thank you. All right, last call for anything Department of Whole Health. All right, thank you, Frank.
Thank you all.
And everybody else who presented. All right, next up is Office for the Aging. We have some budget adjustments. So they're all large enough to require resolutions. So the first one, resolution, budget adjustment, Tompkins County Office for the Aging, expanded in-home services. Does anybody want to move that one? Amanda moves, Susan seconds. Hello, Lisa Monroe.
Hi, how are you?
Good. Anything you'd like to say about this?
Well, I'll just say all of them. I mean, we can, of course, we'll go through each one, but they're all just increases in the grant amounts. It's our final allocated actual grant amounts from the previous budgeted amount is basically just an estimate. So we work within that until we get the final allocation. So that these are all because of that. We finally got the final allocations for them. And luckily they're all increases, which is great.
All like increases.
So this one for ISEP will help us fund another home health aide part-time. So that was great.
Okay, questions or comments for Lisa? Okay, let's have a vote then. All in favor? That is unanimous. Next up, budget adjustment, Tompkins County Office for the Aging, Food Net Meals on Wheels. Somebody like to move that? Travis moves, Susan seconds. Lisa, you kind of said the same for all of them, so just jump in if you need to say anything, okay?
Yeah, is this one, I think for, this one's for WIN, Wellness Nutrition, is that right? There's two for the Food Net. But they're both going to help Food Net, cover additional expenses, and both will be going toward that subcontractor.
Yes, this one is for WIN.
Okay.
All right. Questions or comments? All right, let's have a vote then. All in favor? That is unanimous. Thank you. Next up, budget adjustment, Tompkins County Office for the Aging, Food Net Meals on Wheels, the other one. Travis moves, Susan seconds. Anything, Lisa?
Ditto.
No? Okay, ditto. Any discussion? Okay, let's have a vote then. All in favor? That is unanimous. Very good. And then the final one is budget adjustment, Tompkins County Office for the Aging, New York Connects. Somebody like to move that? Amanda moves. Travis seconds.
Yeah, this is just, this increase will just help us cover more personnel and fringe expenses, basically, for that program.
Great. Discussion. All right, we'll have a vote then. All in favor? That is unanimous. Lisa, anything else from your department that you'd like to tell us about?
Yeah, I did want to mention that our congregate meal site in Groton will be closing at the end of the year. So it's at the Center Village Court right now, a senior housing facility that is run by the Groton Housing Authority. And after 20 years of having that as a congregate site, they've decided that they do not want it open to the public anymore. And that is one of the requirements of the program, is that the congregate site be open to the public so people come in and congregate and have a meal together. So there's been a lot of work around that. It's going to affect probably 10 to 15 folks there that will be, if they're eligible for home delivered meals, they will receive them. We'll also be providing them with transportation to the other congregate site right now, which is at Titus Towers, and we're in talks right now to open a new site. Not in Groton necessarily, but looking at working some different things out. Hopefully spring, we can get another site open that's a little bit closer to that area.
Thank you.
So, yeah.
Any last questions or comments for Lisa Monroe? All right. Thank you very much, Lisa.
Thank you.
Okay, we are moving on to departmental updates. Let's start today with Youth Services, Kate Shanks Booth.
Sorry, guys, I couldn't figure out how to get my screen to turn on.
No, we sneaked up on you a little.
Yeah, I'm sorry. Yeah, so just a couple things. So we are busy wrapping up 2023 in our department and doing some goal setting for 2024. I'm happy to report that we did receive notice from Department of Family and Children's Services from the state that we're going to be getting safe harbor funding. Actually, DSS will get the funding and then they subcontract with us. It is a reduced amount over what it has been. There was a reduction at the state level in funding, but we're gonna figure out ways to make sure that we use that to its fullest potential. And with that, we are getting ready. January is Human Trafficking Awareness Month. So we are gearing up for some social media campaigns, getting out of the community and just make sure that we are educating folks that this does in fact happen in Tompkins County, and to work with our community partners to do that. And we'll really be focusing, again, continuing our work with our local libraries and our rural communities, because they struggle to have access for a number of reasons to the things that are here in Ithaca proper. And then as we work in 2024, we're going to be posting very shortly, right after the new year, for the project assistant and the youth service specialist. There's already been quite a bit of interest in the community, as we've been saying that these positions are coming. And so we hope to have that posted and filled very quickly so that we can continue the good work. And I think that is really what we're up to.
Thank you. Any questions or comments for Kate? Okay, thank you.
Yeah.
Let's see, next up, how about Kit Kephart, Department of Social Services?
Hi there. So we are also, I guess everybody's wrapping up at the end of the year. We're wrapping up some of our programs, but continuing to kind of push ahead. We are currently in our sheltering programs for homelessness. We are sheltering right now 141 people. In the THA program, 64 adults and 7 children, and in our Code Blue program, 62 adults and 8 children. So we're busy. We are working on partnerships, new partnerships right now with workforce development, which we're excited about, to really kind of move forward some new initiatives that we've been working on with OTDA around job readiness within our employment program. And just, you know, the other big thing that kind of keeps us consistently busy these days is you know, constant efforts at hiring, training, developing staff. We continue to see that turnover. We've had greater success hiring, but we're continuing to work with that and get people up to speed. So that's kind of the update right now.
Good, thank you. Questions or comments for Kit? Susan.
Could you tell me what was the total number of people in the shelter being sheltered?
Sure, 141 currently.
Okay, well, thank you, Kit.
Thank you.
Next up, J.R. Claiborne, Veteran Services.
All right. Good afternoon, everyone.
Afternoon.
My main highlight I just want to share is we had our first annual, it will be annual after this year, our first Army-Navy football game watch party. I did this last week. I did in conjunction with Long Shots, which is the new sports bar and grill in the Trip Hammer Marketplace. And we did this with the cooperation with one of our Gold Star mothers, our team RWB, and I can't say it right, the Veterans Colleague Network Group of Cornell. Also our clerk's office and our clerk and our DMV office. And also we had assistance with the reuse center to host this event. Really wanted to make a big family-friendly event for both football lovers who are in military families, as well as those who may not be football lovers but still love the opportunity to get out. And we had about 30 people come out, so I think that was good for our first run at this. We had, this was done in conjunction with using funds with the Joseph P. Dwyer grant That's what helped make this possible to host for these families and our community members. I'm sorry, our community family, I can't talk today, excuse me, our community of veterans. And this, I picked this out in particular because the whole idea of the Joseph P. Dwyer Grant is to provide opportunities and events for that gives veterans and military members chances to get out to do things in support of them. And so, like I said, we had about 30 people who came out, including as one family had a couple of children who got to make some gingerbread houses and do some colorings and Christmas ornaments. But amongst the people who said thank you, I had one veteran spouse in particular who pulled me over at the end to really just thank me for holding an event that gave them the opportunity to not only get out of the house on their own, but also to be around other people, particularly for the veteran to be around other veterans. This is something that apparently was very special to them, and it really underscores the need of what we're trying to meet.
Questions or comments for JR? Amanda.
Who won the game?
You would ask that. Unfortunately, it wasn't the Navy. That was Army 1711, went down to the last play.
Ooh. All right.
I have a feeling you asked that on purpose, Amanda.
I have no bias.
Okay.
JR, thank you.
Yes, thank you. Happy holidays, everyone.
You too. Next up, Ken Clark, Office of Human Rights.
Good afternoon.
Good afternoon.
On Saturday, December 9th, we held in person for the first time since 2020 the Human Rights Arts Competition Award ceremony for grades K through 12 in the various school districts of the county. We held it for the first time at Cinemapolis, as the library was not able to accommodate certain of our needs where we have typically had the event over the last several years. But we had a nice audience of students, parents, and teachers. Emma Steger, who was a fifth grade teacher at Bell Sherman, gave a great keynote talk. As a staff, we are beginning to look at the structure of the competition and make some changes in the guidelines and schedule of deadlines, which we hope will help to provoke or evoke greater participation next year. We also, at the awards event, acknowledged the 75th anniversary of the ratification of the Universal Declaration of Human Rights by the UN General Assembly, which was done on December 10th, 1948. And wanted to do that because that landmark recognition of human rights is what makes our daily work possible. And two other things, just in terms of outreach. I was invited to give a talk by Cayuga Health System, and more specifically Herb Alexander, who is the Officer for Diversity and Learning for the health system. And I gave a talk during a virtual town hall they held on November 28th about building a house for diversity and inclusion, and basically talking about why diversity, equity, and inclusion was important for the health system. And I did that, and I'll just fully disclose that I am a member of the CHS board, an outgoing member. In that town hall, Herb and others were able to review what progress they have made since his hiring 2 years ago in their efforts to centralize DEI in the way in which CHS does its work and provides its services to the community. And then last week, which really made my week, I had a great visit with the fifth graders at Bell Sherman, which included Ms. Steger's students, as well as a couple of other fifth grade classes, in which we talked about the Universal Declaration of Human Rights. I was invited there by Mr. Joseph Volpe, who's a fifth grade teacher there. And the students just brought a great deal of energy, awareness of human rights. It really was indicative of how well they had been taught and how well they absorbed what they were taught. So that was really my highlight last week. So those are my comments for now.
Sounds great. Thank you. Questions or comments for Ken? Okay, well, thank you, Ken.
You're welcome.
Next up, John Mazzello, Human Services Coalition.
Well, hi, everyone. Thanks for letting me step in here for Cindy. I've just got two things to share this afternoon. The first is a thank you for all of you who attended the Home Together Tompkins Summit at the end of November. We had a number of legislators and county staff there. Really good opportunity to either be together in a conference setting, to hear from folks around the state and actually the country around what things are working and what are some new ideas or maybe different ideas, and have an opportunity to think about how we might support people who are unhoused here in Tompkins County. That was put on by the Continuum of Care. And then the second day, when Michelle Carver, who was a federal official with the United States Interagency Council on Homelessness, was able to join for a number of smaller group meetings with individual kind of constituencies, including folks who work in the Continuum of Care, funders, legislators, both from the city and the county, and others. So thanks to all of you who were there. Got a lot of conversations going. There's much to do now, but I think a real direction for some of this work with the Continuum of Care, and I appreciate all the support that you've given to us. The second thing is just something we don't talk about a whole lot, but wanted to share with you, and that's the work that the Human Services Coalition does around helping to bring some federal funding through FEMA and the Emergency Food and Shelter Program into Tompkins County. This is a group that Randy sits on, Randy Brown, and helps us with. But we have a little bit of federal money. This year it's about $30,000. It varies from 50 to 100 to 30. This year it's a little bit lower. But to provide some additional support for community organizations that provide services related to feeding people or providing shelter. And so we recently allocated about $30,000 in funding, and Randy was part of that. So just something that we help to support at HSC, bring some federal money in and help to allocate it to other groups. And we did that recently. So with that, like everyone else mentioned, we're wrapping things up for the year and looking forward to a busy 2024. Thanks.
Questions or comments for John? John, thanks for mentioning that other program, the FEMA money. There's so many programs, there's so many revenue streams. It's really good for us to be reminded of all these different ways that our county residents are being helped.
Absolutely. Thanks very much.
Thank you. All right. Next thing on our agenda is the review of the 2023 committee goals. We do have one more month of this committee in this configuration, but I thought it would be good to trot out the goals to see how we had done, and also because we do have a month left, is something that we wanted to get in by next month. We could try. If not, it can. It's not like any of us are leaving our jobs next month. So there were two versions of it in the packet. They're almost exactly the same. I'm just going to use the one that's on packet page 34. I just thought we'd go over it real briefly. Anybody can say anything they want. The first two things were things that we actually did not do. And what they were consider having joint meetings with some of the other committees. And I guess I could say we did them in that I considered it, but we didn't. I had conversations with the other committee chairs from those committees, and we really could not find a list of meaningful topics that would take up all our time. We didn't want to just do it for the sake of doing it. So that's why those two things didn't happen. Next one up was the whole health's role in the encampments. And if you remember way back, at the beginning of the year, we were involved in this a little bit. We did review a request from the city to clean up some of the debris in one of the encampments on city land, and we authorized some money for that. And nothing on that particular regard has happened since. It might happen again going forward, but at this moment, that was the last time it happened, was the beginning of the year. Opioid Task Force, big check mark on that. We took it from start to finish. We had a committee that, reviewed all these, we put out requests for applications, we reviewed them, we made recommendations, and as we talked about earlier in the meeting, that is starting to roll out. Next item up was the SNAP benefits. We were looking to explore ways to try to get SNAP benefits into the hands of more eligible people in the county, people who are eligible but are not yet getting those benefits. And we did not get anywhere with that. There were just a variety of things that stopped us from doing that. They have to do with the regulations. This is a federal program, and they have very strict and stringent regulations, not a lot of flexibility there. And we just weren't able to make this happen. So we can think about carrying it forward next year or some other version of it, however, wherever that conversation goes. Next up was childcare, and we did one session, just like we said we would, at least one presentation on the state of childcare in Tompkins County. We put mental health as a topic, and we didn't address it head on too much. We did have one session with the CEO of Cayuga Health Systems where the main focus was on their response to mental health. And certainly it comes up in a lot of other ways that this committee interacted, but we didn't exactly take it on as one big topic. Home health aides was one of our goals, and we again had a presentation earlier in the year on home health aides, and we just heard from Lisa Monroe that looks like we're getting some more money to hire a second home health aide that's going to work for the county. So I think we should probably try to get an update on it again sometime in the next year. And then finally, the Medical Aid and Dying Act, and that is something that we achieved that goal. We had a good presentation and we had a follow-up and a letter of support signed by 11 legislators. So that's that was the goals list. Does anybody have anything else they want to say about that, Amanda?
Well, you forgot the most important thing, that we welcomed a new member to our committee. What month was that? February, March?
February.
Yeah.
Yeah.
So
well, that's nice of you. Thank you.
You've been here almost a year.
Yeah.
And thank you to Dan for leading the charge this year and for one more month.
Right, so I'm going to add that Susan joined the committee. I guess I realized too we could celebrate our color, our color schemed, whatever the right word is. Oh, that is.
Trying to take over my committee goals.
So bad. That's why I wasn't on the goal list. All right, moving right along. Next up, advisory board appointments. Advisory board appointments. So we have quite a list here, so let me read them. To the Community Mental Health Services Board, Howard Reed. Term expires December 31st, 2026. Sheila McHenry, thank you. Member, term expires December 31st, 2027. Larry Roberts. Member, term expires December 31st, 2027. Jeanette Lynch, member, term expires December 31st, 2027. To the Community Mental Health Services Board and Developmental Disabilities Subcommittee, Kaki Wunderlich. Community Services Board member representative, term expires December 31st, 2027. To the Community Mental Health Services Board, Mental Health Subcommittee, Benjamin Comore. Consumer representative, term expires December 31st, 2024. Susan Tabrizi, community member, representative, term expires December 31st, 2027. Larry Roberts, consumer representative, term expires December 31st, 2027. To the Community Mental Health Services Board Substance Abuse Subcommittee, Noah Valdez, community member, term expires December 31st, 2024. And to the Human Rights Commission, Anna Ortiz, member, term expires December 31st, 2025. Does somebody want to move those assignments, committee assignments? Randy moves. Susan seconds. Any discussion? Randy.
Yeah, I'm on the Community Mental Health Services Board, and they've been struggling to get quorum on that. So this actually fills up the slate for them, and a lot of very qualified people that will help quite a bit, I think. So, yep.
Excellent. Thank you. Any other comment? All right, let's have a vote. All in favor? That is unanimous. Thank you. Next up is minutes approval. Does somebody want to move the minutes from November 20th? Travis moves. Amanda seconds. Discussion about the minutes? Okay. All in favor? That is unanimous. Comments from committee members, liaison assignment reports. Anybody have anything they want to say? All right.
Will we be color coordinating this committee next year, do you think? Or like we did at GO? I mean, a lot of people have blue on today.
Kind of an accident. There was no memo today.
Just saying.
Maybe we should put that discussion off till next month. Anything else before we adjourn? All right. This committee's adjourned. Thank you, everybody. Holidays, everybody.